Here I'm starting with an active test, starting with hip flexion. I simply asked my client to bring her knee as high up to her chest as she possibly could. Here the iliacus, psoas, rectus femoris and sartorius. We then moved on to adduction. I passively lifted up her leg so that it would not get in the way of her range of motion and asked her to move her leg inwards as far as she could. We then repeated this on both sides. For internal and external rotation, I began by getting her into hip flexion with her knee at a 90-degree angle. When in this position, I asked her to perform internal rotation by trying to get her foot as inwards as possible. Here she took it quite literally and moved just her foot, so I corrected her, getting her to try and move her leg. We then went into external rotation, which was described to her by imagining she's trying to get her foot as far outwards as possible. I then got my client to face prone on the bed, so face down, in order to perform leg extension. I simply asked her to try and lift her leg as high as she could behind her. We then went into adduction. This is where I asked her to move her leg as far out as she could by starting her on the opposite side of the bed so that we had stability throughout. She then repeated this on the other side. We then moved on to the passive movements, starting with hip flexion. I completely relaxed her leg and did the movement of hip flexion for her, making sure that she was not in any pain. This was repeated on both legs to be able to compare one side to the other. Here we're doing adduction. I'm simply bringing her leg across the other one, making sure that she is relaxed and comfortable throughout. This is then repeated on the other leg. We then went into passive abduction and making sure that I'm pushing her to her limit to get the full range of motion, however making sure that it is not hurting her. We then passively went into internal and external rotation, making sure not to push her too far due to the awkwardness of this motion. I then got her to turn over onto the bed so that she is face down in order for me to do leg extension. I made sure that she was not in any pain throughout as I could not see her face, so I had to ask her rather than being able to use her face as an indicator. I then got her to perform the functional movement of a squat. This is so that I could see the full range of motion of her hips.